development is not an all or none phenomenon. Unlike the NICU, either you have a normal blood pressure or it's abnormal. And we know what we're looking at and we know the numbers and we can treat. Development is much more fluid, and it drives a lot of my colleagues crazy when they come from the NICU into the developmental clinic because it's not so clean. We can have children that can demonstrate typical behavior and in the same day demonstrate disordered behavior. And so typical behavior is what we expect most children to demonstrate. And that's what the average child gets up and walks at 12 months. That's what we expect. Problem behavior is behavior that is often environmentally mediated. So an example would be my child. When I come home from work, it's like another child has been dropped off from the carpool. She's irritable. She is hard to discuss anything with. She has really weak attention, can't do her homework. And then you feed her and you put her to bed and she's a different child in the morning. So that's a problem behavior. It's annoying. It's annoying as all hell. But in the morning, it's like she's had a lobotomy and she's all better. That isn't a disorder because the environment was able to modify the behavior. So that is an important distinction, whereas disordered behavior, in order to have a disorder, the behavior has to be present in multiple environments. So in school, at home, in Girl Scouts, or wherever the activities are. So for example, attention would be weak and hard to control in all of these settings, not just the school setting. So when we talk about the data for the Prem, and a lot of the data I've showed you, those are children that are demonstrating disordered behavior, and the prevalence is up. There's many more children who demonstrate problem behavior, but it doesn't quite swing into the land of disordered. It doesn't mean it's not a problem, and it doesn't mean that they're successful in school. It can mean that they're really having a hard time still.